Let's discuss levels of prevention. Various levels of prevention are applied at various stages of disease progression. Our disease progresses from risk factor to outcome. So, we will discuss today's session according to following learning objectives. We will discuss levels of prevention, their types, their application. Then we will discuss modes of intervention, their types and their application. In the end, we will summarize the session. So let's start with levels of prevention. There are 4 levels of prevention. Primordial prevention. Primordial prevention is done to stop the development of risk factor. Then there is primary prevention, to stop the development of disease. Then there is secondary prevention. We do secondary prevention to diagnose the disease. Then there is tertiary prevention. We do it to limit the complication. Primordial prevention, phase of disease is underlying condition. We have to stop underlying condition which causes the disease. And in primary prevention, phase of disease is risk factor. We have to stop the risk factor from progression. Then in secondary prevention, the phase of disease is early pathogenesis. Then in tertiary prevention, the phase of disease is late pathogenesis. And what is our target? Primordial prevention, our target is population or whole population. We can do it on whole population. In primary prevention, our target is whole population or high-risk groups. We target these groups. And in secondary prevention, our target is patients. We do secondary prevention on patients. And we do tertiary prevention on patients. So, all these levels of prevention are applied at various levels, at various phases of disease, and various populations are targeted. Primordial prevention, we have to stop the development of risk factor, and we apply it on whole population. If risk factor is developed, then we have to stop the progression of risk factor. We will apply it on high risk group or in whole population. When risk factor invades, it causes a disease. We have to do secondary prevention in early pathogenesis. And then we have to do tertiary prevention in late pathogenesis. And both of them are done in patients. Okay. We can say disease process starts by risk factor. It causes outcome or disease. If we stop risk factor, we can do primordial prevention. And if we stop the progression of risk factor, or we stop the interaction of agent, host, and environment, we'll do primary prevention. And in early pathogenesis, we do secondary prevention. We have to diagnose the disease and treat the disease. And in later pathogenesis, we do tertiary prevention. These levels are applied at various levels. We have to limit the outcome. We have to reduce the mortality. We have to reduce the morbidity. We have to reduce disability. So we have to stop the disease process as early as possible. Then we'll discuss them one by one. Primordial prevention. We have to stop the development of smoking, because smoking causes ischemic heart disease. It causes lung cancer. So we can stop smoking. We can stop this risk factor from development by healthy lifestyles, by counseling, by guidance, by health education. Obesity. Obesity may lead to diabetes. It may lead to hypertension. So we have to stop people from becoming obese by healthy lifestyles. This is primordial prevention. Then in primary prevention, there is agent, there is host, and there is environment. Risk factor has developed. Risk factor is present. We have to stop the interaction of this risk factor with host and environment. Like agent. Salmonella typhi causes typhoid fever. It is present. Host is present. Host high risk people who are at greater risk